And so with external beam radiation, the field is sort of raced into imaging. We can't get enough of cone beam CTs. We do it, nearly every day in some patients who are getting external radiation. But with brachytherapy, it seems like you had to sort of drag us kicking and screaming into image guidance. But there is data here that imaging is very helpful in cervical cancer. It turns out the pelvic exam is not that accurate. We actually get it right maybe half of the time compared to staging accuracy from surgery. Now, what about MRI versus CT? The accuracy is much higher, with about a staging accuracy of 86% compared to surgical staging. And MRI was found to be superior to CT for detecting uterine body involvement and parametrial invasion in this Akron GOG study, and MRI superior to detecting vaginal extension as well. Now, as you can see here in this particular patient in these axial, sagittal, and coronal images, that there is extension into the parametra here as well as quite bulky lymph nodes. And in this sagittal projection, you can see the tumor up into the low uterine segment. Now, about a decade ago, the Geck-Estro group came up with these MRI brachytherapy guidelines. Now, image-guided brachytherapy isn't necessarily something that's evolved over just the last 2 years, but I think that the data has matured pretty quickly in the last few years that we would consider it almost to be the standard of care now if you're delivering brachytherapy. So these guidelines are published, so I don't want to dwell on them too much, but the high-risk CTV is perhaps the most important volume to be contouring. That includes the GTV, the whole cervix, presumed extracervical tumor extension, and any pathologic residual disease that you can feel but not see on MR imaging. As you can see here, this is just a figure taken from the Geck-Estro guidelines showing the high-risk CTV contoured and the D90 dose prescription, which is what they use in sort of lieu of point A. And I think in one of our case presentations, we may be going over this as well. And then with the intermediate risk CTV here in blue, you can see the coverage as well.